Welcome everyone. Thank you for participating in the 10th OneTech webinar. My name is Jimin Seo, Clinical Specialist at OneTech, and today's host. Today's presentation title is Satisfactory Vascular Treatment with Free Laser. Today's speaker is Dr. Hugues CARTIER. Next page. He is a dermatologist at the Clinic Saint-Jean, Arras, France. He is also the Chief of Wound Care in the Dermatology Department of Arras Hospital. He is a member of several associations, including SFD, SFP, SFA, SFDCE, EADV, and laser groups. And he's also in charge of global course coordination at INCAS Congress. Before his presentation, I'd like to briefly introduce the free laser system. Next page, please. Free laser is a long-pulse KTP and Nd:YAG laser. It is a FDA and CE approved device. Its specifications is on this slide with the smart contact cooling system. Next page, please. And next page. Before his presentation, one more thing to remind you is that feel free to ask any questions using a question box in your control panel during presentation. We will have time to answer the questions at the end. So, hi Cartier. I'm glad that we have you here for today's webinar.
Okay, hi everybody. It's a pleasure to speak with you by website. We discuss about the laser from OneTech. It's a specific device for vascular disorder, also for pigmentations, skin rejuvenation, and skin remodeling. So we will show you some personal pictures, and maybe we can discuss how to do. First, we can discuss about the theory of the selective photothermolysis. We need three conditions to have a photothermolysis. The wavelength is very important to recognize the chromophores to be absorbed by the photon. And the energy, you need enough energy to destroy the target by a thermal effect, and very important things, the pulse durations, that it's thermal damage time, and it's a power of this device that you can modify as well the wavelength. You have two wavelength, 1064 and 502. The fluence between the 1064 and 532 is KTP laser, and also the pulse duration from KTP from 1 millisecond to 40 milliseconds, with the Nd:YAG also a very powerful emission, and the Genesis, it's automatic setting with a 0.3 milliseconds for skin rejuvenation and skin remodeling. So what's about the principle of the long pulse laser? To coagulate the vessel of the small venous, you need to treat the telangiectasia or the legs vein by thermal diffusion, and you transform, modify the photon in a heat, and with the heat diffusion, you destroy the target and around the target. So, but with a good setting, the purpose of this laser is to destroy as well only the vessel and respect around the vessel to reduce skin injury. So it's very important to know and to understand. So we have a good paper for that from Rox Anderson to see you all paper also to understand how it works. Okay, and you have to understand that you have to destroy all the wall of the vessel. Is very important to reduce the risk of a side effect. Also, we will see. So you have two wavelengths in this device. The 1064, well known for depilation as well. You can use it for depilation, but the power of this device, of the V laser, is also to destroy the deep vessels, the large vessels, the blue vessels, the periorbital vein. We will see you after, and also well known the 532, the green emission, to destroy the superficial vessel like rosacea or also pigmented lesions. So you will see in this curve that is very important to have the both, and with this device you have the possibility to cover maybe whole on mostly indication in dermatology, because between the pigmentations, deep or superficials, and for hemoglobin absorption for superficial and deep vessel also. So with the KTP, you can use for epidermal vascular, superficial vascular disease, superficial pigmented lesions as rosacea, small port wine stain, and lentigo, or why not for photorejuvenation also. With the 1064 is well known for deep vascular lesions and legs vein, venous lake, and also some pigmented lesion, but it's most difficult, but maybe to reduce, why not, some melasma, but we can discuss, but very difficult with a long pulse, but also sometimes it could be worse. And skin rejuvenation and skin remodeling or skin tightening as well. You have different definition to speak about that. What's about, we can discuss about the possibility to compare the green light, the 532 nanometers from V-laser on PDL. It's a long story. Sometimes we can also discuss with the IPL to compare what we know, that the both works. That's very simple to understand. So some patients, some practitioner want to prefer PDL. In my office, I have the both, but with the 532, it's easy. Maybe it could be more easy to manage, because in this laser you have a touch screen, you have an expert mode, you have an automatic expert setting as well as you want. So it's very easy to switch on the device. It takes only few seconds. You have a cooling handpiece, you have a large spot, so very easy. So we can compare, but you know the absorption also is very well for the both. So we can use the both if you have, it's okay. But with the V-laser, you can do so many things that I think it's not necessary to have the both in most of the cases you have in your office also. And you know, with this very possibility to reduce the time emissions, it's also until around 1, 2, 3 millimeters. You can also induce a purpuric reaction, purpura as well, if you want, if you need. So it's very important to know that with this new type of device, you can do many things as PDL is most interesting. So the second thing to understand that you can also do many things if you combine the both. The both is for superficials and also for deep. And with a good setting, you can also combine for as well skin rejuvenation, skin remodeling, if you combine the both, or also for superficial and deep vascular disease. So it's easy. If you understand that, you can modify the setting and you can treat many indications in dermatology also. Sometimes if you, for remodeling, you can also reduce some fine wrinkle, but to prove that, you have to do many sessions to induce the reducing of the fine wrinkle. But most of them, this device is easy to use. It's very important. It's very simple to use for a young practitioner and for all one also, because you have possibility to modify the setting as well as you want. So for vascular lesion, you know, with the possibility to modify the diameters from 2 millimeters to 12 millimeters, you have a large band of possibility to destroy skin pigmentation or large vessel. Even it's more difficult to destroy large vessels than more than 5 millimeters, because it could be painful. So be careful, because you hit sometimes too much around the vessel, so be careful. You have to take time for the procedure, so you have to be very gently with the skin and to protect, and don't forget that you have a cooling handpiece, and it's very important to use it. You can modify it without cooling handpiece, or sometimes you can put 5 degrees, 10 degrees. Nobody speak about the possibility to modify the setting of the freeze on the cooling handpiece, but it's very important, because sometimes to destroy some superficial pigmentation is very important to reduce the freeze, the cooling, but for large vessel, it's very important to reduce around maybe 5 degrees. Very important to understand that. But with the possibility of this device, you can modify it as well as you want. Very important. And with this new device, you can treat many things, from the smaller and lighter vessel, from the larger and darker vessel as well, from red to blue one, or sometimes some green also when it's deep under the skin, from small size to large size also. You have 8 possibility of setting of the diameter of spot, and it's very easy to modify or to change it when you want. It takes few seconds. The cartridge is also immediately recognized by the device, so you don't spend time to modify the setting also. And with this new device, because you have the possibility to modify the time inhibition, you can induce selective photothermolysis, or sometimes, as you want, thermal photocorrection. You have to discuss with the patient which one they prefer, because sometimes you have some more side effect where you induce purpuric reaction, but maybe you can obtain some maybe more efficiency in less sessions. So for first example, it's with this KTP laser from Vontech, it's easy to destroy because it's a large vessel. You can also start to destroy the biggest with the NDIAG with a low setting, only 20 milliseconds, less than some 100 millijoule is necessary. And after you finish in the same session with a KTP, with also this setting for by example 8 joule, 12, between 10 to 12 milliseconds. You can make a test before to treat all the area, and with a 10 millimeter of diameter of the spot, so it takes maybe less than 10 minutes to cover all this area with a low pain for the patient, because you are also the cooling hand piece is very important. You have to take time, you have to proceed step by step. Sometimes you can induce, you will see after, some edema, but you have to manage. Be careful for the sun eviction. You have to put some sun cream if you live in the south or under the sun. But for this patient, we need only one session, to reduce maybe 90% of the vessel of this face, because it's very, very easy to do with so large vessel. For this man, the skin is more thicker. You have to you're more thick. You have to destroy also. You can modify the parameters with maybe more energy, and it's easy to do. The most difficult is to treat all the area and don't to forget the small part of this vessel. So it could be happen. So you need some time to explain to your patients that you need maybe 1, 2, or 3 sessions, but less than 3 sessions you can cover and treat all the area with a good result for a long time. Another example with a video, you proceed step by step. The frequency as well is 1.5 Hertz as well as you want, and you will see through the window the vessel disappear. You have like a contraction of the vessel. It disappears immediately, so you know where you are. You have to put a small layer of gel. It's very important to facilitate the penetration of the photon, but it's easy. It takes like maybe 5 minutes to treat all this area. So it's very, very fast treatment. Even it could be little pain, but you have to take time, and you can explain to your patients that you can take maybe few minutes if some patients are anxious by the laser. For rosacea on women, it's not so easy because it takes time. You have inflammation, you have vascular disorder, you have a thick skin, a seborrheic skin. So maybe you have to take 2 sessions to reduce the rosacea, the cutrosis, the redness. You will see the second picture is just after. So we induce redness immediately, and after during few days some edema. You have to explain to the patient to prevent that, and to explain that it is normal situations. It's not really a side effect, it's common. So you have to explain, but you can see some good result in 2 sessions, and you induce almost maybe a rejuvenation also, you know, the complexion of the patient is completely different between the first and it's a reason you can also use this device for photo rejuvenation only with a KTP, with a green light. For a man, you know, some inflamed skin with a rosacea, with a dilated pore size. So you can also maybe reduce at first the vascular redness, vascular disease in one sessions with a setting, you know, 15 milliseconds. It could be high for you, but sometimes it's necessary to have more thermal effect as well, to modify the skin structure, to reduce the pore size, to reduce the skin texture. So if you have more thermal effect, you can modify that. And if you proceed with many sessions, it could be better for the patient, even if you induce also always some edema during a couple of days. So another patient for a phototype 3, not so easy. Be careful with a KTP 532. For high phototype, it could be difficult. More than 4 is more difficult to treat, so be careful. But for phototype 1, 2, 3, and almost the start of 4 is also possible with this patient. The third picture is just redness just after the sessions, you see. In my clinics, we treat between 6 and 2 months, sometimes more. Some patients are coming because they come again, they're coming back in my office maybe every 6 months, but the common situation is every 6 or 2 months as possible, because sometimes we have a social eviction less than 2 days, but it's always a weekend in France, and we know, you know, that in France we love weekends. So it is possible to treat some phototype high, like 3, you know, and you will see the result 2 months after, you know, with less redness, less inflammation. So patients are happy with that, with a quick and faster treatment. For radiodermatitis, it's well known, you know, for breast cancer. Sometimes it could happen after a few years. So you can also take the KTP 532 because it's a superficial vascular disorder, you know, with a small telangiectasia, you know, and you see the scar, the old scar, the white scar you will see between in this redness. But you see in one session it's easy. You see immediately as a second slide, a second picture, you will see little gray. The vessels are gray, a little. It's a carboxy hemoglobin now. You know, that means that you destroy completely inside the vessel, or I can persuade you that it's very easy to destroy all the vessel in one session without side effect, and patients are very happy for that because it's very frequent also in Europe to obtain that. Another session, you know, for this patient with also inflammation, rosacea. The second slide is always with redness, small edema, but patients are not unhappy because I explained to the patient what happened immediately, what happened in few days after the session. But after 3 months, after 6 months, you know, you need only 2 sessions, and you will see you reduce the redness of the patient. So it's very efficient and with a fast treatment, and you don't need many sessions. With this setting, it's not necessary to use a purpuric reaction because it's not easy to manage, even it's also efficient. For legs, you know, because I'm dermatologist, but I'm also phlebologist, and I do that a lot in my office. You can reduce also some legs vessel. It's not so easy in these cases because you have to. It was, you know, it's a side effect after sclerosis, chemical sclerosis. You know, you induce matting, so you have to reduce because patients are unhappy after that. So you propose. So some colleagues send this patient to visit me and to propose some laser. You have to start at first in the middle, and you progress to reduce to the center of the vessel around the matting, you see. So you start here and you proceed progressively to push as well the vessel, the blood, the flux, the blood, and you push it and you finish here because it's very important. Be careful, you have to see if you don't have a red circular vein because you have to treat, because if you don't treat also, you can have a new recurrence of the vessel. So you can also induce with this large vessel some pH, pigmentation after many laser is common also for dermatologists, but you can manage and don't take a long way. In maybe less than between 3 months, you can reduce with some hydroquinone cream or cortisone cream to reduce that. Very easy. Another clinical cases, is on the ankle of the legs. You see just after the session, you have some redness. It is common. This is normal. You have to explain. It's little more painful in this area, and you will see in one session you reduce. You have to continue the session. We'll see some small video, and you will see immediately. You follow the vessel. In my practice, I prefer to start by the smaller and to finish by the bigger. Sometimes I put some, I spare some space between two shots, and I come again back and I finish to reduce the skin injury by the laser. Very important. So you have to take time. It takes time. You have to explain to the patient, because if you proceed too fast, it could be painful, because it's also NDIAG 1064, or most patients say it is painful. But if you proceed very gently and slowly, it takes time. You have the cooling handpiece, and we'll see just after it disappears totally, completely. It's full, so it's easy to manage, and you have a good result for this patient to expect. Another example with this video on the white skin, it's very easy to do that. Sometimes you have to modify the setting during the session, because the vessel have different diameters, so you have to modify. By example, I put in my setting between 20 to 40 milliseconds with a spot of 3 or 2 millimeters, and the fluence is between 150 to 230. It's depending where we are just in the vessel. So it's very important to modify, but with this device it's easy and it's quick to modify the setting. It's very easy. So very, very important. You don't spend a lot of time to modify the setting. It's immediate. So another cases, you have to find also the reticular vein before to treat, because if you don't do that, you can have a new telangiectasia and come again. So it's very important to for the process to go step by step, and I repeat, but as in my practice, I prefer to start by the smaller and to push the blood into the vessel, just to close from the reticular vein. Also, another picture is very difficult, because it's like a Venus lake. So be careful. You have to reduce maybe at first the setting, and you finish with the highest fluence for the smallest, but for the biggest, you have to explain to the patient. It could be less painful, or sometimes you can understand some pox. That means no more. You have to put some time as well the cooling handpiece, and to wait few seconds, maybe 2 minutes with your cooling handpiece, because to reduce the skin side effects like necrosis, because you have a lot of blood inside the skin, just very superficially. So be careful. You have to the procedure is very, very slow. You have to take time and be careful. You have to good setting, but with this V laser, it's easy to modify as well. I told you. So you see, in 3 sessions you can reduce, and sometimes you need more than for legs vessel. Maybe you have to explain to your patients that you have to wait maybe 6 weeks, 2 months, 3 months. Don't be so afraid by the time of the delay to reduce the vessel. It takes more time than for face. So another possibility, another video for large vessel is very important. In my clinics we use trans illumination, epiluminescence to see where is the small telangiectasia, and also where is the reticular vein, to be sure that we treat all the area. Is very important. If you don't do that, the risk is to have a new vessel come very rapidly, and patient could be unhappy for that. So you have to take time with a slow motion. You can do also, in this case, a 5 millimeter of diameter of the spot, and you have to use bandage and cortisone cream just after the session during few days to reduce the pain, to reduce the inflammation, to reduce also the hyperpigmentation. It's very important. So another example with the NDIAG only, and you have to modify the setting between 3 to 5 millimeters. 3 is for the red on the purple, and 5 is for the blue on the almost reticular, like green. We say gray in France. So you have to treat. Sometimes you can have some little pigmentation after the session, but don't be afraid. And the good question: do we have to treat the reticular vein or not? It's not so easy to treat with NDIAG because it's painful and it takes more time. Some patients are happy to treat only that, but you have to explain that the possibility has to have a new telangiectasia from this reticular. So maybe you have to treat again every year or every 2 years as well. Some common very side effect: just an edema of the vessel just after. You have a small edema of the skin, superficial skin, but don't worry. You can put as well, if you want, some cortisone cream to infuse it to reduce that. You have to prevent from sun. It's very important. And some crust also. When you use very small spot but with high energy, you can induce small thermal effect. It is common also, but in these cases, it was my fault. I think I used too much energy, and patient was not very painful, so she don't feel nothing. So I continue the treatment, but it was my fault. But it's not a wound, so it's easy to cure. And because it's a white skin, there's no risk of skin injury after that. Another example to manage is very important because you have a lot of possibility to have pigmentation after treatment with a 1064 for legs vessels. So it's very important to prevent and to explain to the patient it could happen. So you have to explain how to cure or to prevent also. So another example, so it's very easy. You have to take time, and 2 sections in less than 3 months, you can reduce completely this small unhappy legs vessel on less matching telangiectasia. Another possibility is a red socks, but the red socks is very difficult to treat with NDIAG because it's too deep laser for that. So you use superficial wavelength like 532. So you will see with a large spot, you can treat very easily. It's easily, but be careful only on white skin, phototype 1, 2, 3. Be careful, more than 4, it could be dangerous. Even you have an expert for the setting of the device. So you will see the result in 2 sessions. You can reduce more than 90% of the patients. But you will see on the last slide, she was under the sun, and I explained to my patient, I can't do the 3rd session because it's too dangerous to induce some blister because she has a suntan. So I prefer to wait a few months and she come again with a normal skin to avoid burn injury. So another example of the forehead, easy. We treat because it's a large vessel. You can try to do with a KTP, but it's like a legs vessel, so it's more easy to treat and more fast to use 1064. It's little painful on the forehead, so be careful, but it disappears immediately in 1 session. It's easy also. Now for the periauricular vein, is very difficult. If you are a young practitioner, don't do that. Okay, it's very important to protect the eyes, but when you understand how to do that, it's very efficient and for a very long time. I have many patients, they are coming for that. Young, you will see another patient, an older patient with dark skin. It's not a problem because you use a 1064. But very important for the procedure to understand how to do that. I will explain just after. Another patient, very close from the orbital. So be careful. You have to proceed very gently, very precisely. Very important. Immediately after, and after 5 months, you have no recover of the small periorbital veins. You know, an older patient also, you see a beautiful venous, a dilated venous of around the orbit. So it needs, I prefer sometimes, I think it's better for you to treat with 3 millimeters diameters, but when we are very we are not close from the orbit, you can also use a 5 millimeters. It's depending which kind or which diameter of the vessel, but we can understand that 5 millimeters is more dangerous than 3 millimeters. Okay, it's very important to be sure that when you treat, when you shoot, the shot is above the bone, never in the direction of the eye. It's very easily to understand. A large vessel, so you have to protect with a goggle inside the eye, very important. Sometimes you have to need an assistant or nurse to help you. Sometimes you can also make a small local anesthesia, because with this large vessel it's painful, you know, but you will see in one session you can reduce completely the large vessel with a leg vein. So it's less, it takes maybe less than 3 minutes. You have to explain. Just after you can sometimes have an edema on the little pain. You can have some pain during few days, but you have to explain. You can also take some anti-inflammatory drugs by tablets to reduce edema on the pain, but it's very efficient also. How to proceed? You know, I use my diode laser to see where is the vessel. You have to protect the orbit on the eye. You have to start at the plumb line of the pupil, and you go step by step to the junction of a superficial branch of the temporal vein. So you start here, and you start here, and you proceed step by step, shot by shot, and you finish here at the junction. It's not necessary to continue for the forehead, because in this area you can treat, but it's come again very rapidly in my practice. So I prefer to stop at the junction. You have to, patients are a little anxious because they understand they are very close. So if you are not sure to treat only above the bone, don't treat the patient. Very important. For pigmented lesion also, it's very easy because you can also use both. For dermal pigmentation is a 1064. For epidermic disorder, you can use a green light to treat more superficially. So you have possibility to set to show what you want. I explained to you for this patient, she wants to rejuvenate his face. So it's easy. You use in these cases KTP. You use the frequency is 1.5. You try to treat the complexion. It's easy with the KTP because at first you can treat some vascular disorder, but we know that you can also modify the complexion of the skin, and you proceed all the area. You use with the KTP low setting, and you can combine many. You can do many sessions, and you clear the skin with a possibility. It's a fast treatment, a large pole. You have to use cold gels, and you have a cooling on piece to reduce the pain. It's easy to do also. But you know, the possibility is to modify the pulse durations, so short or long, depending what you want to do for skin pigmentation, or also to induce more thermal effect. So if for skin pigmentation, if you want to destroy immediately lentigo, you have to put maybe 5 or 4 milliseconds. A joule is necessary. Just after, it could be more gray. D'accord? And you have some trust during a few days. And if you want just for skin rejuvenation, you can put more thermal effect. So you put exactly the same settings and for cuprosis. You have to explain to your patients that she will have some edema or some redness in a few days. And maybe you combine the both. And if you modify it in the same session to destroy superficial skin disorder like dark spot, and also rejuvenate the patient always superficially, you can also use only the green light, the 532. But if you want to induce a skin remodeling, a skin technique with a deeper action, you can combine in the same session the 1064 to induce a thermal effect as well with the genesis. I will show you some pictures. So you have to be dermatologist. It's very important. You use a dermoscope or dermoscopy to be sure that you don't destroy the nevus or the skin cancer, and you have to destroy only the dark spot. And you will see in one session you reduce completely the dark spot and you don't touch the nevus. It's very important, and to explain to the patient. So it's very important to make the diagnosis. So for the skin remodeling and the skin tightening, you have to use the genesis. It's 0.3 millisecond with fast motion to induce a thermal effect, and you have to shot a lot of you have to make a lot of shot, very important, to induce diffuse redness just after the session. I will see you. You can also use for scar, young scar. You can use also the same device for acne to reduce inflammation, acne, active acne. You have some picture, not in this presentation, but I have some in my office, or I do in my office also. It's very important to understand that you have to elevate the skin temperature, so you can use a large pulse, and you can combine the both for skin rejuvenation, for skin tightening, or for skin remodeling. So with the dual wavelength, you can do the both as well as you want. I will show you with the skin rejuvenation of the low setting. So you try to modify the complexion, so you reduce the redness, reduce the superficial skin pigmentation. Okay, and as well, easy, no painful, because it's not very high frequencies, but it's easy patient. You see the patient don't move because it's not for cuprosis or rosacea. It's just to be more beauty. So just after you continue, and for 1064, the same. It's another woman, you know, but on the neck, it's not so easy to treat the neck. Now we understand. You will see some shot. You know, you can understand the shot. Okay, it's very fast. It's a fast motion, and the purpose of this treatment is to treat all the area and to induce thermal effect. You will see in this part of this area, I put 3.5 fluence, frequency 10 Hertz, 0.3, spot size 12, and you will see, I do 1,500 shots only in this area. So it takes time. You have to explain to the patient. You have to move, because if you stay at the same place, it could be painful. So be careful. It's also NDIAG. So NDIAG, if you stay at the same place for with a lot of shot, you could be too much thermal effect. Is not the purpose of the procedure. Very important, but easy to do, you know, and to explain that you can reduce some wrinkle on skin tightening, skin remodeling, and you have the firmness of the skin after many sessions. You need maybe 5 to 10 sessions. You have to explain to the patient. It takes more time, but it's not very dangerous if you have a good setting also. But all in the expert mode, it's you have the touch screen, so you have nothing to do, just to respect the setting, the automatic setting. So 8 points just after the session, you will see if you treat a split face, you will see just a beautiful redness. It is normal, it is common, it's not dangerous. You have to explain that it could be stay for maybe 1 day, no more. So you have many indications for active acne, for diffuse redness. If you combine KTP or NDIAG for young scar with NDIAG, or also KTP if you have a thin scar or very fresh scar, you can use KTP. If you have to modify the thickness and to modulate the firmness of the scar, you can use the 1064. Onychomycosis, you could use also with the genesis with 0.3 milliseconds, very important, on skin tightening, also hair removal. Even I don't use this device for that, but you can also use sometimes if you are in trouble with another device. This V laser can be used for hair removal for small area also, and for white to dark skin, because it's a 1064, very important. So in a single session, you can use to treat many patients with a lot of indications. Thanks a lot. It's a pleasure to make the presentation some personal clinical cases, and maybe if you have some question, I'm okay to answer to you.
So thanks, Dr. Cartier, for your great presentation. So we're so impressed. So now we'll go ahead to take some time for questions. So just a reminder, please be sure to leave your questions into the question box in your control panel. So we've got some questions. So the first question is about cooling temperature when treating telangiectasia. So what is your inner settings for telangiectasia?
Of the face, of the legs?
Face and legs.
For legs.
Yeah.
It's important because you have more diffusion of the thermal effect. So you need maybe 5 degrees is very important. And you have to wait after each shot to wait a few seconds. I think it's more important to wait more after than before. So you have to wait because sometimes we are we want to proceed too fast. Very important to be slowly. For face, you know, the diffusion of the thermal effect is completely different. So you can proceed with more power, less maybe degrees, but my favorite is always 5 degrees because you have no risk. But if you wait too much with 5 degrees, you induce a vasoconstriction, you know. So the purpose is not to wait too long with one piece. So it's a reason I prefer to stay more longer after the shot than before. Very important. Okay.
Okay. So, and how many passes you deliver for rosacea treatment?
Can you repeat the question, please? Excuse me.
So, how many passes you deliver for rosacea treatment?
In the same session?
No, how many passes?
No, normally, if you have a good CT, one is enough. Because when you observe through the windows, you can see the vascular contraction with the carboxyhemoglobin for the large vessel. If it's a diffuse redness, it's more difficult to see that. So sometimes you have to induce a purpuric reaction. And with the purpuric reactions, you know, with very low millisecond, between 3, 4, 5 milliseconds, you know, you induce a purpuric reaction. So you will see immediately where you are. With a thermal effect, a thermal coagulation, you don't see really where you are. So you have to push the gel to know really where you are. So sometimes you don't need for 2 passes, because more you have passes, more you induce thermal effect on edema, and it's also not necessary. Sometimes for leg telangiectasia, you know, when you use the 1064, as the first passes, the vessel don't disappear. You just induce a small edema inside the vessel. So you shot for the legs, on the legs, you have nothing, but you go in another part of the body, and you come again few seconds after that, and you repeat at the same place, and just maybe few seconds after the first shot, maybe more, around 30 seconds after the first shot, because you induce an edema in the vessel. When you make the second passes, the vessel disappears. So for leg vessel, it could be necessary to have 2 passes if your setting is too low, but for face, normally it's not necessary for redness of the face. For the telangiectasia of the nose, you have to use normally the 1064. Be careful, you have to use as possible the small handpiece, the small spot, maybe 2. Be careful, the 3 and 5 is maybe more dangerous, because the nose is very specific, and it's very common to have some crust, and after that a skin necrosis. And for nose telangiectasia, only one shot, only, not a second passes, because it's too dangerous to induce a scar. Okay.
Okay. And what is the good endpoints for leg vein or in a periorbital vein treatment?
For legs vein, sometimes it don't disappear, but you induce an edema inside the vessel, and it could be enough. If it disappears immediately, it's okay. Don't do more. If you listen a small pox, that means you have too much blood in the vessel, you have to reduce the energy. Very important. Okay, it's a clinical, it's visual. So if disappear immediately without poke, it's okay. But if you have just an edema on the vessel, don't disappear. You have come again on few seconds after, and it takes sometimes more time to disappear because you induce an edema inside the vessel, and the flux of the blood is stopped. So it's necessary to make another shot. But it could happen sometimes that for a large part of the vessel, of the leg vessel, you treat step by step, every maybe 3 millimeters. You don't follow really completely the vessel. You spare a small area between two shots, and you come back to finish between the two first spot. You understand? So it's more precise than for face. For face, it's easier to treat only the nose, because be careful for the scar. And for the periorbital vein, it could be dangerous because you have the eyes. So it's very important, and you can use only 1064 because KTP is not enough power, the wavelength is not okay to destroy a large vessel, so you have to use, at first you can start by a small vessel, very important, on maybe only 3 millimeters. But if you are very far away from the orbit, you can treat also with a 5 millimeters, because with a 5 millimeter, you can be sure that you destroy all the size of the vessel, and you follow the vessel until the junction with the facial vein, temporal vein also. So, but be careful. On periorbital vein, I think it's necessary to see another practitioner to do that, to be sure that the procedure is very precise and very efficient at all. Okay.
Okay, so good to know. And how many passes you deliver for skin rejuvenation procedure?
Good question. For dark spot, when you set, you put your setting as well, maybe 5 or 4 milliseconds, and you put maybe 6 joules with a diameter 5, and you see the dark spot and you shot. It is gray immediately, is okay. Sometimes you can repeat gently, and you put sometimes 5 degrees if you are a little anxious by the skin emission, the thermal diffusion. But the dark spot had to be more contrast, more gray, more dark. It's difficult for very light dark spot. Very light. It's better to treat with a pico or a nano laser. But for a dark spot, when it's brown, it's okay. On very superficial, you have to be sure with the dermoscopy that it's not cancer. That's first point. But after that, you can destroy very easily the superficial dark spot in one session. It could be gray. You have some gray or brown, more contrast just after the shot. Okay, and you have some crust during a few days. So for the dark spot, you can treat and repeat maybe 1, 2, or 3 shots in the same session. And sometimes I prefer to cumulate 3 shots with a low setting than only 1 with a high frequency, because the risk is to inflame too much under the dark spot and to have inflammation during few weeks, and patient will be unhappy. For the skin rejuvenation, it depends what we are talking about, because for me, skin rejuvenation is normally only the file under the 32. When we described the efficiency of the vascular laser 20 years ago, it was for redness on superficial dark spots. So skin rejuvenation is very superficially for me. But if you combine with the 1064, you go through the skin under the superficial disorder for remodeling or for skin tightening, to obtain a skin more firm, you know. So skin complexion and skin texture, if you combine the both. And for superficial skin rejuvenation, you can focus on dark spot, and you can treat all the area with a large pole of the KTP to reduce and to modify the complexion. And if you repeat the session, patient will have some skin more clear, you know, more brightened. But if you combine in the same session with the 1064, you try to modify also the texture of the skin. So you induce a neocollagenesis. But you combine the both in the same session. It could be, I prefer to combine in the same session, it takes less time, than to make the choice. The first session KTP, the second session 1064. I combine all in the same session, but you know, where I live in Europe is also a white skin, phototype 1, 2, 3, but it could be different where you are. If you are in South America, if you are in Asia, be careful with the sun. Also, you have to make the right choice to be sure that you don't induce some pigmentation after that, hyperpigmentation. Is this clear?
Yeah, so thank you for the specific answer to the question. So it's gonna be the last question. So do you use less cooling for pigmented lesion treatment? So what is the cooling temperature setting?
Yes, sometimes we use no cooling on piece for to destroy the very light dark spot. You know, very light. If you don't see heat, you have to reduce at all. But you know, the hand piece is the time. If you can have some, if you want. Maybe you can put 10 degrees, you know, for skin pigmentation. It is enough, not necessary to put 5 for vascular 10 degrees, but it's depending how long you stay with your spot, you know. If you stay a lot, you reduce the temperature of the skin. So it's very important for skin pigmentation. It's necessary to destroy the skin pigmentation. For vascular, it could be different because you have the heat diffusion with the hemoglobin on the water. And sometimes you use also the Nd:YAG. Nd:YAG induce more thermal effect than KTP, you know. So be careful. It's the reason it's necessary to have a less temperature with Nd:YAG than for KTP, but for KTP, you can also use a fresh gel. You know, sometimes I put my gel from the freeze and I accumulate with a cooling handpiece also. So normally for skin pigmentation, 10 degrees is enough. For redness with KTP, 5 degrees is enough. For Nd:YAG, 5 degrees always.
So
Okay?
thank you. Yeah, so this is the end of today's webinar. So in case you have any inquiries about today's webinar, so please do not hesitate to contact us at the email address shown on this slide. So thanks again, Dr. Cartier. It was a pleasure being with you today.
Bye-bye.
And thank you all participating in the webinar today. And you can review today's webinar via OneText website or YouTube within 2 weeks from today. So next webinar will be posted soon, and then see you at the next webinar. Thank you very much.
Thank you. Bye-bye.
Bye-bye.